Well, hey everybody, I'm Morgan Moulthrop. I'm the Curriculum Director at Nova Vital, and I thought we'd do something really special and interesting this week. When we're dealing with trauma and healing, I thought that we would talk to some experts from our own IOP office in Shreveport. I have Layne and I have Tonya here, and we're just going to have a discussion about trauma because I think, for all of us, and we've had this discussion with one another, maybe we'll just start off with, kind of what is trauma really as far as your definition is concerned? And I'll just ask Tonya first. What is trauma? And people hear the word a lot, but how do you explain it to a client who's new to recovery?
To me, trauma is an event that happens or events that happen in your life that have a profound effect that you might not realize at the time affect your mental health, your stability. But as time goes on and you replay the event or you feel the repercussions from the event.
Reliving the event.
And a lot of times clients, like in our assessments, will ask, have you ever experienced trauma? And people are like, what does that mean? Because you think about it, I had someone one time that was like, well, I lived through Hurricane Katrina and our house flooded and we had to evacuate. But no, not really.
No, not really.
Real trauma, but it's like, that's kind of a traumatic experience, to have to do.
And I think, from our standpoint, we talked about this, I don't think we have very many clients who haven't experienced trauma when you look at the broader definition of it. What's your take on that, Layne?
Much the same as Tanya's. I think anytime we experience something that will trigger fight or flight response in the brain, around the amygdala and the old primitive brain, I think will constitute trauma. And you may not react to it immediately, but since the unconscious mind forgets nothing, at some point, since it's impacted the fight or flight response, there's a potential for later in life, at any time in life, for a trigger to fire that off again.
Yeah.
And so it's largely, I think it's an unconscious process. I think, like Tonya was saying, some of our clients say, well, I've never experienced trauma. Well, okay.
Yeah. I don't, give me 5 minutes with you and we'll talk about that for a second, right? And it's funny, in residential, when we work over here, we see people flashing out a good deal, and that's a very good indication that, and you've got the hypervigilance and that type of thing that occurs. So when we talk about trauma and we talk about addiction, what do you think the intersection between the two of them is? I'll just roll off saying I know that there's a connection between trauma and addiction. And I know that the research is kind of following that. How does that play out for you guys, Tonya?
Well, a lot of times, we talk about treating addiction, and how sometimes people just want to learn the steps, and go through the steps.
Right.
But it's, I always treat it like, to me, that's like slapping a Band-Aid on a wound and not actually getting in there, cleaning out the wound, stitching it up, making sure that it properly heals. We're just kind of, it's like a quick fix, which I think is why a lot of times people.
Right.
But because, we talk about all the time that when you're using a substance, you might not consciously realize that you're using that to kind of mute the way you feel, but that's what you're doing. You found something that works to not make you feel the way that you don't want to feel,
Yeah, and I believe with regard to the steps, if Bill Wilson were alive today and he had the research that we have, then he would certainly put that in some of the material that people were having. So it's funny to see that you say that and all that. Yes, there's room for that, but there's also a great deal of room for us to do some trauma work. How does it play out for your clients? I know you have a little bit of a different take on trauma with clients because of your background.
For me, so I had childhood trauma, not just childhood, but it continued throughout, like teen years. And then I would re-traumatize myself later in life because of my addiction. But what happened with me personally, and I think it relates to the clients, is I was anxious all the time and had no idea why. And I was a mascot type person and a clown. So what I was doing was experiencing pain, and then I would cover it up with funnies, just acted that way. So when I first took a drink of alcohol, I was off.
Yeah.
It was the first time I'd experienced my body just went. And so, and I tell people, I got sick as a dog, thought, my God, let me get well. I'll never do this again. 2 days later, I was even drunker.
Yeah.
And that's the pattern. And I think a lot of times that happens. And from the research is indicating that extreme stress activates, again, it goes back into the amygdala,
Yeah.
and the connection between addiction is just like that.
Yeah.
So if there's a propensity genetically for there to be addiction in the family, all you have to do is fire it off by starting to use
The trauma. Yeah.
And typically, it's just like with the research with PTSD and war victims. If the trauma's there, at some point, if it's re-triggered, it's going to fire off. And so I think a lot of the clients that we see have been so traumatized, and their alcohol and drugs fit so well that the payoff of not using feels worse than the negative effects of using.
Yeah.
And so I think that's the way that plays out, and it's almost impossible not to be traumatized.
Yeah, it isn't. And you're talking about the amygdala, that reward system, the reward pathway where all of the addiction is played out is also the exact same pathway where the trauma is played out. And so it's very hard to separate the two. You start feeling better for one, but feeling worse for the other. So I think, we're talking about triggers in that sense. I think that it's triggering to deal with the trauma, but if you don't deal with the trauma, then the trigger will always be there ready for you to reignite your addiction. So what are some of the signs that you all look for within your clients that you're dealing with some trauma?
The anger, quick anger reactions, the shutting down, when any questions are asked, anxiety.
Yeah, I think you're right. The denial, the big, it doesn't happen to me.
Yeah,
We had a
this-
perfect
nothing-
family. What are you doing? Everything's fine then. Well, how did you end up here? Oh, I just like doing
I
drugs.
just like to drink. Yeah.
Right. So that's funny. I hear that quite a bit
Yeah.
myself. Layne, I wanted to ask you what tools or approaches that you use when someone's experiencing trauma responses.
Well, they're like in the group setting.
Yeah. Yeah, let me ask that again, if you don't mind, because I was looking at them, but I'd rather not be doing that. What tools do you use specifically when dealing with trauma in small group?
Let me give you an example from this past week. We have somebody that's quite traumatized. One of the things I use a lot is humor, because it's an intense emotion, and it's at the other end of the spectrum of pain and shame. So if you can get I find if you get the humor going, it'll open a slot there to move in with some information, and then pull back out real quick. Only enough to give them a glimpse of, okay, this is what I'm going through. Let's get out of here for a minute.
Yeah.
Because once they have access to it, they have it. And I don't think it's appropriate to just fly in there and then open it up. If they were able to deal with it completely, they would have.
Yeah.
But just putting that little wedge in there kind of they become curious about what's going on. And and the other thing is to normalize, because of the work that you've done, rather than talk about denial defenses and they're just horrible patients. Well, no, those are trauma responses and they're survival skills. And so I don't think it's compassionate or ethical to take those away from them immediately. Just when they're ready to do it, make sure they're loaded with the tools, and when it's time, it'll happen.
Yeah, traditional thought has been, oh, well, we can't deal with their trauma while they're here, but I think just it doesn't take a whole lot. But as long as you're confident about what you're doing and have some kind of education about trauma, I think it probably behooves us to do to amend that particular old idea. I mean, what's your thought on that, Tonya?
I think, like Layne was saying, especially in the group process or group setting, just normalizing it, kind of explain, having them understand that this is a trauma response that you have learned because it has worked for you in the past. It might not be the healthiest way of dealing with what you're dealing with, but it's a survival skill, survival mechanism, whatever you want to call it. And it's just like using drugs or alcohol to cope. It's a coping skill that you've learned that has worked for you in the past.
Yeah.
And so we're trying to find healthier ways to deal with the stressors or whatever. But I think the normalizing things, because that comes up a lot in my groups where
Yeah.
people are like, oh, well, I didn't know this. Like we'll start talking about some of it, and I'm like, yeah, how are you supposed to know this?
Right.
If you don't, like we don't teach this stuff in school, and this is the kind of foundational things that you're supposed to get from a healthy childhood and a healthy, hitting all the developmental stages on time and all of that. But honestly, who does that?
Yeah, because if you'd have learned it, then it would be post-traumatic growth, not post-traumatic stress, right? I mean,
Yeah.
because you either get through it or you don't, and if you don't have the skills, how can you do that? And that's really our job, is to help them with the skills to kind of deal with difficult situations. Maybe, in some ways I try to visualize it as you're the adult. I mean, you're now an adult. You can go back into that situation as an adult and really help be the adult in a situation where there was, and reprocess that. Which, and what Tonya said brings up a question now I want to ask you, Layne. A lot of clients feel, ashamed of their trauma, and they feel like, oh, I should be over it by now. And I wonder if you've ever had how you address that. Or I should be over my trauma, right? I mean, that's just stupid.
I guess there are different ways. One thing you could say is, well, you are.
Yeah.
You are. You're sitting right in that chair, and you haven't had a drink in 30 days. So largely, in some degree, you're over it.
Yeah.
And then I also like to give them credit for
Great.
the reason you're here is because it's time for you now to get better. And you've made that decision. And just the fact that you're here means that all the information that we're teaching now, you already understand and are applying now, aren't you?
Yeah.
Which, by the way, is Ericksonian embedded
Yeah.
hypnotic languaging skills, and it will go directly into the unconscious, and they will use it whether they like it or not.
Yeah, and I love that. I mean, well, you were going to say something.
No, I just said that's interesting.
Yeah, I think that's great. I love that. That's one of the things that I'm really happy that we have such a broad kind of understanding of this. With between all of us, we're not people who shy away from trauma, and I think we do see that connection. So, what advice, Tonya, would you give someone who's afraid to confront their trauma? Like, I don't want to deal with that. I mean, what do you do with that? Or
Well-
no, it's more like, I know that I have this. I'm really afraid to deal with it.
Well, it's all about, the relationship that you form with your clients, with the counselor, because, you want to make sure that they're comfortable with you and that you're providing a safe space for them to be able to go in to talk about the trauma. Because that'll happen, all the time. And sometimes I'll use humor too, with like Layne does a little bit, and be like, well, how's it been working for you so far?
Yeah,
Like you're here for a reason, yeah, basically, so, so it's all about just providing a safe space and having the tools to have them not get too far, not decompensate or whatever term you want to use for it, and if they do, be able to bring them back.
Yeah. So that's it. What I've found a few times, and this, you learn by doing, is that sometimes when I'm ready to kind of close the session out, the trauma, something will pop out from somebody right at that point, and it's very difficult then to just hold everybody in the room until you get to a point where you can do something about it. I don't know if you've ever had that before, but it's like, would you please have your trauma experience at the beginning so we have all of it, so that we can wrap it up for you? But it's messy work. It's not going to be perfect. It's going to be like that. So what can family members do to support people who are decided to take the plunge and deal with their trauma? Yeah, well, I mean, what can they do? Not what they do. What they do quite often is different than what they should do, perhaps.
Well, I think it's real important for family members to receive education,
Yeah.
because they truly believe, and I understand why they believe that, this is like willful acting out stuff. They just want to be bad, and it's not that at all. And if the family can understand, it's about, it's from here up.
Yeah.
It's not just about I'm a jerk or whatever. And if they can at least get some kind of understanding about that, it would be very useful for the patient and his recovery or her recovery. The other thing is, they're built up with so many years of denial, they need therapy themselves, and sometimes education alone is not enough.
Yeah.
And so I think because we don't do that I don't think we do as much family work right now as we could be, but that's part of that is because some of the population we see, families will just refuse to participate.
Because they're dealing with the same issues. If
Yeah.
because the trauma generally came from the family of origin, and so Tommy wants to deal with it. That means mommy basically was somehow involved. She may have all sorts of her own feelings about it.
For sure.
And if it was a value in the family for you to deal with these traumas, it would have happened already. So you're walking into a minefield with all of that.
And another thing, on that same topic, a lot of people will talk about their perfect upbringing.
I love that, right?
My parents they never drank. My grandparents never drank or smoked, and I'm thinking, well, good for them, but they can have an addiction and they're not going to know it until they drink or use a drug, and they can't not do it anymore. So that's not a valid argument, and I try to break it to them easily, or as easily as I can.
Or like, they never drank, but then they raged all the time in the house, right? So trauma is something many of our clients carry silently, and understanding it is a crucial part of the recovery journey. Just one last piece of advice from each of you about our, and this specifically for our IOP clients and at that stage of recovery that they are, because they do have a little bit of safety and security. They have a little time under their belt. Any last words of advice on dealing or healing from trauma? From both of you, Tonya?
My advice to all of my clients in group is to embrace the process. Like, just don't fight it. We're here, you have to be here anyway. You might as well participate in the group, because we have mandated clients or, whatever their situations are. And, because a lot of times they'll come in and they'll be like, I really didn't want to be here. I just didn't. And then they're like, but I actually like coming to group because it's support and it's what I need. So I would just, for clients to actually embrace the process and lean on the group to help them get through it, because, there's probably several people in this room who've experienced the same thing,
And I think that's the beauty of trauma, is that if one person's brave enough to do it, it quite often opens up the door for others to do it. And when you have a group that's actually focusing on those kinds of issues, you're actually going to another circle of hell, a little bit better cohesion in your group, and certainly it forms trust and a certain level of confidence, both of those types of things. And if I was Layne as a counselor, I'd say, see, you are doing it now.
Right.
Your one piece of advice, Layne.
So, a lot, I agree with everything you said. Sometimes in working in group, if we're doing trauma work, I kind of take it as it presents itself. And one of the things I notice is that the other people will do the work, and you can glance around and see what their physiology's doing. And if they've checked out, they're doing the work. But as far as, really, they don't have any choice but to do that, in some ways. But also to encourage clients that, because we know some of the stats, and I hate to say it's statistically driven, but if you've got somebody with an extensive traumatic past, they may not get it on the first time. So I think it's really important to make them feel comfortable enough and to know, okay, if you relapse, it's not, you're not a failure. Do come back. So we want to give them enough information so that in the event that they do get out and they get triggered or they act out, relapse, that they'll know where to come back to and be welcomed with open arms, not like, oh God, here they come again, which is a failure kind of approach to it, and then it makes them feel like a failure.
And I think the other side there is, okay, well, let's just kind of pick off where we left off, because there's no perfect amount of time for every individual, like, oh, this is 28 days or this is 9 days and you're going to get everything in that period. It just doesn't happen that way. And the way it is if you do have a relapse or whatever, we have the capacity and the staff and the talent to help you without you having to re-explain everything to somebody else. So I think that could be very helpful to actually come back and say, hey, I stumbled, I had a little bit of a problem. And I think that's one of the things we try to do at Noble Vital, is to really make sure that they understand that we're not judging them on a relapse. That's because we've all had them. We've had them ourselves. That's part of the recovery process.
We had a fellow come in yesterday who had been in IOP with us a time or two, and he's also been here. Well, he was just discharged from here, and he just dropped by to say hi and just kind of, he wanted some suggestions. Didn't necessarily want to jump right back into IOP, but he had some other stuff. And I thought, this is great. He trusts us and feels comfortable enough to come back and say, what do you think I ought to do?
Yeah.
And then my advice to him was, I think you've got a lot of insight into what you need to do. Things are changing.
Yeah.
Take you a few days and see what you can do with that.
Yeah.
And he knows how to contact us. And I said, reach out, definitely, if you need to. But the fact that he knew where to come back, and he had established a level of rapport with us, that I think that's just getting come in for treatment and then stay sober forever. That's not necessarily the goal. The goal is, like you were saying initially, establishing the rapport so that they feel comfortable enough, because there's nobody else they feel comfortable with, obviously, or they would have gone there. But I think that's our job, is to, I hate to use it, old cliche, but keep coming back, but it's true.
Well, I mean, come back until you don't have to.
Yeah.
Come back until you don't have to a certain extent, because I think building up our ability, our confidence is extremely important, so that we can do those tasks on our own. And always as counselors, we're there not to do it for them, but to really help them get the confidence that they can do it themselves. I want to thank both of you for coming in today and having this kind of trauma roundtable interview discussion. I think it's the kind of thing that really does set us apart. And I want to say on behalf of Nova Vital how great it is to have your kind of capacity working with our clients. So I know it shows every day with them. So thank you very much for that.